Good afternoon, everyone. How's everybody doing? We're going to officially call this Wayne County Community Correction Advisory Board meeting to order at roughly 3:06 p.m. Can we have a roll call?
Chief Judge Pro Tem Larry Williams, Pastor Eddie Williams Jr., Deputy Chief Tiffany Stewart is excused, Andrea Smith is excused, Janella Robinson, Judge Donald Knapp,
Here.
Armand Harris, Chief Robert Dunlop, Eli Day, Tam Sharikian, Paul Bruno, Chief Judge Pro Tem David Braxton, Dr. Keisha Allen is excused, and Commissioner Alex Garza is also excused. We do not have a quorum present.
Okay, before we get started, I want to ask Mr. Day to, he's one of our newer CCAB members, and I believe when his first meeting, he actually did not introduce himself and tell us a little bit about himself and his background. So we're going to give him an opportunity to do that now.
Okay, cool. How we doing? Am I on? Okay. Thanks, y'all. What's going on? My name's Eli. Eli Day. This is my second meeting. My background is in community organizing, grassroots organizing, and investigative reporting and covering inequality, labor, criminal justice system stuff. And it's a pleasure to be serving with y'all. Thank you.
Thank you, Mr. Day. We don't have a quorum, but fortunately, we don't have any action items other than the approval of the minutes. So I believe we will pass that.
Yeah, the minutes will be passed to a future meeting.
Pass to a future meeting. What's next on the list?
D, unfinished business, there is none listed. Moving to item E, new business number 1, collaboration program update.
Okay, number one, I just want to keep everyone, first of all, let me backtrack. I did speak with Aiden. Aiden is Higgins, right? I don't want to, from Commissioner Garza's office, and Commissioner Garza was unable to be here today. But he insisted and encouraged that we continue the meeting because of the rhythm and the importance of what we're doing. So we're moving forward. Again, there's really no action items, but it's imperative that we understand what's going on, the progress we've had, we are making, although it may sometimes seem like uh, moving like snails, but there's progress being made, and I wanted everybody to be on one accord, understanding what's going on. First of all, is collaboration program update. Before I speak, there's two people in the audience. I'm gonna say audience that I want you all to meet. Is Addie Satchwell. She's a staff attorney from Neighborhood Defender Services in Detroit. And then Michael Davison, he's the social work supervisor from Neighborhood Defense Services. We've had collaboration. We've met several times regarding them helping us with our utilization of our programming. I think it's very critical because of the offenders that they service. So I'm going to ask both of them to come up and tell us a little bit about themselves and what we've talked about when it collaboration and partnership. You can come to the table and just when you speak, just make sure you hit the button so the green mic is on.
Hi, I'm Addie Satchwell. I'm a staff attorney at Neighborhood Defender Service, and I had reached out just to learn more about community corrections and see specifically if there was a certain program that I've used in other parts of the state that community corrections happen to be in touch with, and got a lot more information about the programs that are available to our clients. So I think we are really looking forward to collaborating and working closer with community corrections in the future, because right now we didn't know about a lot of any of these really opportunities to the extent that we now know for our clients. And Neighborhood Defender Service serves, we're ramping up to serve 50% of indigent defendants in Wayne County. So that's an increase. So it's a big portion of the people who could really benefit from these programs. So we want to expand our relationship and make sure that we are getting people into these programs, being aware of what is available for our clients, and if there's data that we could help provide also about utilization of the programs or anything of that nature. We have quite a lot of demographic data that we collect. So I don't know, some of that could be useful. And then we also spoke about the big dream of perhaps pretrial services through community corrections in the future, which I think would be a huge point that a lot of our clients would utilize. So Mike can say that all a lot better than I can, though. He's the brains of the operation.
Not necessarily. My name is Mike Davis, and I'm the social work supervisor at Neighborhood Defender Service. And just as Addie said, we are really excited to learn more about the programming. We think, we know that it will give our clients many opportunities post-conviction at this point. We are excited about the possibility of expanding the pretrial offerings in the future. We're really happy to make the connection, and also since we've met Lester a few times, I have a list of things that I'm developing in my mind of other programming that would be really helpful for our clients to consider in the future, that are often part of probation services but are very difficult to access at with any kind of reasonable fees for people that are indigent. So we're happy to be here and happy to be developing this relationship, because we will send lots of referrals.
Great. Does anyone have any questions for Addie or Michael?
How many social workers do you have?
I am the social work supervisor. We have five right now. We're ramping up our staffing to fit. Like Addie said, we're moving up to carrying 50% of the felony indigent folks in Wayne County. And as we hire more attorneys, there's a possibility we'll hire another social worker or two as well.
And our office has both social workers and client advocates. So those are overlapping roles, but slight differences, I think. And
right,
they divide and conquer.
So the social work in our office is split up between social workers and client advocates. Social workers are master's level social workers who are able to carry out clinical functions because of their licensure, and client advocates are folks that minimally have bachelor's degrees who are able to carry out social work tasks that don't necessarily require licensure.
What is the function of social? Can you kind of frame for us what the social workers do?
I certainly can. Social workers, they write mitigation. One of the biggest things that our social work staff does is complete mitigation on behalf of clients. Typically, that's for pretrial negotiation purposes. We meet with clients and collect their social histories and assess their needs. And when we write mitigation, we tell their stories and describe their needs and describe how their needs can be met moving forward. And then the attorneys use that in plea negotiations in order to ideally get outcomes that include treatment. And but there's a lot more to it. I can go further and further, but
Seeing that
Could you speak in your mic? Speak in your mic.
Oh, I'm sorry. Seeing that we're short of things to do here today,
sure.
why don't you just
Absolutely.
give us
So more than that, the social workers, we meet with folks to assess their mental health and mental health needs, history, substance use or misuse needs, history, develop treatment plans that they'd be able to utilize moving forward, ideally in community-based settings after disposition. And we assess in times of crisis, mental health crises. We will work collaboratively with the client and the attorney to help people get the help they need in moments of crisis. And I'm leaving one. Oh, We work closely in the process when folks are referred for competency to stand trial or criminal responsibility. Again, we meet with clients, we assess their needs. We get our own clinical impression and collect records that they're able to flesh out a person's path to this point that we're at right now. And then we collaborate with the Forensic Center folks to make sure they have those records. And yeah, I did a lengthy course for one of my clients in Judge Knapp's courtroom this past year for a young man. Yeah.
I think that Mike is also not bragging enough because the Neighborhood Defender Service is a holistic defense organization. So our aim is to acknowledge that when people come into the criminal justice system, they are not coming in as a blank slate who comes in with a charge and that's it. This is a whole person who may have substance abuse or substance use issues, mental health problems. They may be currently facing eviction. They may be currently losing custody of their children, and all of these things interact with each other. So the social work client advocate team is critical in helping the attorney to address all of the needs to get the best possible outcome, so that if somebody may beat a criminal case or find a really good outcome in a criminal case, but they lose their house at the same time, and that puts them back in a pipeline to potentially be in front of the court again. There's also just myriad things that the client advocates and social workers can do. One of our client advocates got one of my clients in touch with an organization to get the heat turned back on in his home when he was this winter living in essentially a semi-abandoned house with no utilities. And she was able to get him in touch with a community organization that helps with bill pay so that he could weather those storms, right, and have heat. So there's any kind of situation where I say, I don't know how to fix this, but this is something that needs to be done, I will be contacting my social worker or client advocate, and they can really move mountains for our clients.
So do the attorneys go to landlord-tenant court to prevent an eviction as well as representing them in the criminal court?
So we cannot, under our current contract, do that because Neighborhood Defender Service has a contract with the county. We are representing people on felony criminal matters only, although we have a landlord-tenant team that is getting off the ground now.
Right to counsel.
Right to counsel. So that is getting off the ground, and that is a kind of separate team. And I don't know exactly what the functioning of that is going to be going forward because they're hiring specialists in that, but we are opening that as one of our teams and do hope to be working more in that area in the future. We're starting now, but I'm in the criminal team specifically, so I'm not as privy to those discussions except when I go bother people and ask questions.
Well, thank you so much for coming. Like I said, we're excited to be partnering together, and hopefully we'll start getting some referrals maybe as early as next week. All right. Okay.
Thank
You don't have to stay in.
you.
If you want to go back to your seats, you don't have to stay. Thanks again. All right. Next on the agenda.
Item 2, uniform flyer brochure update.
Okay, now with this, I sent you all some things and you have handouts, but before I even address those handouts, I wanted to let you know what's going on from our end. I've actually started consulting with our IT department, which is going to be very critical because our website definitely needs to be updated. So I'm consulting with them, waiting for them to get back to me. So how soon can we update the website? I want to know if the program descriptions will be on their referral process, and maybe even a QR code to streamline some things to be on our website. What we do notice is know that it'll be more detailed things on our website. because some of the information, like Judge Knapp, what you requested, is more streamlined, particularly for the judges that's on the bench and everything. But more detail will be on the website. So those are some of the things. We'll also incorporate a thorough community correction guide, as well as maybe a resource handbook for everybody. So you could just go to our website and get all that information. So that is one of the things that we're working on. And that's one of the reasons I also gave you these handouts. The first one is it says Real Solution Services. It's a violence prevention heat. Don't worry about the title right now, but I just wanted you to have an idea of what the referral will look like. The referral document will look like, and what will be required. You notice at the end, it has my email and it has the vendor's email. We'll also include phone numbers, addresses, and different things like that. But I wanted to give you an idea of what the referral document will look like. Try to make it as simple as possible so that we can get the ball rolling, and everyone will know the necessary documents that are needed for the referrals. Any questions with that one so far? And any time when I send forms or anything, if you have any suggestions or questions or anything, just let me know, because again, this is fluid. Everything is ongoing, and I know it's going to be numerous changes, but we need to actually start somewhere, and this is really our starting point, and making sure that we have everybody on board and knowing not only our programs, but how do they get in our programs. Okay, the second and third handout are simultaneous. Remember at our last meeting, I mentioned, and I believe Judge Knapp has some concerns too about something particularly for the bench and to have, so they know about our program. So what we did is we put together a brief, very brief blurb of 5 programs that's funded by the grants. Judge Knapp so graciously responded and said he recommended a little bit more information, such as the what, the who, the why, and the results, because that's what they want to know. So let's look at the first one when you talk about the ETRS, Domestic Violence Batters Prevention Program. So what is it? You got two phases, 2 phases. You have the jail-based, which is 90-day in custody portion of the program. It says that is structured cognitive behavior intervention designed to address criminogenic thinking and behavioral patterns. Then you have community-based. Give me a second. I'm sorry about that. Community-based, 26-week portion that reinforces and extends learning into real-world application. It is group-based, processing real-life stressors, peer accountability, and relapse prevention. Participants may complete, this is critical, both jail and community components, or community only, depending on court orders. So that's the what, a brief synopsis of what. Who? Programs designed for repeat domestic violence offenders, individuals with prior police involvement that score moderate to high risk on the compass, and those demonstrating patterns of control or coercion, felony offenders, male and females. Then you have the why. Domestic violence is a learned behavior, often recognized by offenders, especially in non-physical forms. We have a dual phase model that addresses the root causes, promote accountability, and support long-term behavior change. And the results, the program aligns with evidence-based practices and is committed to delivering a structured, evidence-informed approach, and enhances public safety, supports judicial outcomes, and promotes long-term behavioral change with the following supportive research. 15% recidivism rate for program completers versus 37% for non-completers, 10 to 30% recidivism for completers versus 30 to 50% for non-participants. And then cognitive behavioral programs, reduce violent behavior and recidivism. Judge Knapp, what do you think about that? Is that a little bit more than what you was
No,
thinking?
I think that's much more helpful and certainly clear. Without being too deep in the
Yeah.
Without getting too deep in the weeds, the only thing I guess I would ask that be added is, we've got the jail-based program and then the community-based program. You can do both or just the community-based. If, let's say, for example, I order the community-based, what's missing, or is there anything missing that they would get in the jail-based program?
Well,
Or is it just, I mean, in other words, if I did the jail-based program, are there things that are going to be repeated in the community-based program, or does the community-based program cover everything that you get in the jail-based program?
the jail base is like 90 days. Community base can partner with that depending on the needs of the client or offender. If that, because so it'll be more thorough community based if they're jointly together. Like if you say, I want them to go to jail, they could do 90 days and then they will pick up where they left off in 26-week program. Whereas then sometimes jail-based only may be enough or community-based may only be enough. So I think it depends on who's making the referral and what they think will benefit the person. But they could do one, other, or both. I hope that.
Well, I guess my question is, if I just say community-based,
Okay.
I'm not necessarily ordering jail-based, are they covering everything that
Yes.
it would get in the jail-based program?
Yes.
Okay.
Yes. The jail-based program also, you have to think, so they can start while they're in custody. So they don't have to wait to the community. If they're in custody, we can start giving them some services immediately. So what I read, I also have another one for Lake Ridge. That will basically, we're still shaping that. Now remember, this one more so is based for the bench. But we'll have access to everybody who wants it because we're going to also develop a more comprehensive community correction resource guide that has all our programming. Because what I did is I asked the vendors to submit the answers to these questions because I wanted their input and everything. And I have 2 to 3 pages of information about the programming, each programming. I know that's too much when you're trying to make a decision. So, but however, that information can be on our website and can be printed out more thoroughly for anybody who wants it and needs some more comprehensive analysis of our program.
Right. I mean, so that might be good to just add at the bottom. For more information, go to www. Whatever the address is.
Okay. So I have putting a little bit more clarity to the jail-based and community-based, as well as adding a blurb at the end, more information, go to the website.
And I do think this is great. I think this is going to be helpful. I mean, like I said, I think at our last meeting, having, a one-page sheet like this that I can stick in a folder or binder on my bench and just refer to it along with other programs can help, me and other colleagues select, the programs that we think would be beneficial for a person who's maybe coming under sentence in front of us.
Okay. And it'll be more, I actually typed this myself, and it'll be a little bit more fancier, so to speak, because it'll have our logo and everything, so people know it's from Wayne County. So it's Wayne County Community Corrections, stuff like that. And that's what I have as far as, let me see, where are we at? Oh, another thing also, we're also looking at, are they called trifolds? The brochure, trifolds of each program that we can pass out that the vendors will have explaining their program. We want to make them physical as well as electronic. And that's the goal of everything, to have it physical, be able to be printed out, but also be able to just email it electronically to simplify some things. So not only are we not just cutting down so many trees, but we're just making it a little easier for those who are more per se tech savvy and want to just do it real quick. So we'll have both options. Again, as soon as I start getting information from our ID department about how quick it'll be, we'll get the stuff updated and everything. I will let everybody know. But until then, if you have any questions about our programming, if you think somebody is eligible for our program or anything, just give me a call, shoot me an email, and I will make sure that if I don't get back with you directly, I will make sure that my staff gets back immediately. We thought we had a referral yesterday that I was dealing with, and we could not find the person's information under MDOC, and I reached out to one of my favorite people that's in the courtroom, Miss Jackie Drahan, and she basically said, Mr. Thomas, that's 35th District Court. I believe, was it Jackie? Was it 35th District Court? So that was a misdemeanor. So that's one of the reasons we couldn't find, so they were not eligible for the program. But it was good to have partnership and people that you can count on, because sometimes just getting certain documentation, you need to be able to call somebody. So those are the regarding the uniform flyer brochures update. We're trying to make sure everything has some type of uniformity. So nothing will be different outside. Whatever it comes from our community corrections department, it will have uniformity. Even though some of it may be streamlined, it will all be the same. It will all tell about the requirements of the programs. It will and it will say the same thing, and it will have the contact people, the referral, everything the same. It's almost like starting from scratch to make sure everything is the same. That's why your input so far has been so valuable. Ms. Robinson was so gracious today that she sent me copies of information from I believe it was Washtenaw County Community Corrections as well as Oakland County Community Corrections, just their brochures and information, their resources guide and all that stuff, which is a great template for us to move on to develop our own and also put that on the website. And Neighborhood Defense Services had stated they have some data and different things that they will be able to provide for us to help with what we're trying to do, which is galvanize our stats. And that's going to be the last thing I think we talk about in a few minutes. Any questions on the flyers or updating information?
I've got a quick question
Yes.
for you. I'm looking at the Lake Ridge Village Jail Plus program.
Yes.
Under Y, it says it is a non-punitive, growth-focused program that operates in a safe judgment group, or is it supposed to be
It should be
non-judgment? Non-judgmental. Okay.
Non-judgmental.
Okay.
Yeah.
Thank you.
Yeah. Remember our last meeting, I actually said that I went to sit in on, I think it was ETRS domestic violence in the jail as well as Lake Ridge program to see it for myself. They were on 3F. And so yeah, it's non-judgmental. And that also it gave me an idea of at times limited capacity, which may be hindering our utilization. That's something we also are working on.
Sheriff Dunlap deal with the whole issue of space over there?
We had started dealing with it. So now we gonna have to find how we gonna do that. We gonna get it done though. We'll get it done. Okay. Can we move on, Octavia?
Item 3, Michigan Department of Corrections contract update.
Okay, one of the things I wanted to bring to your attention in speaking with Molly Maynard, who's in the court from MD. Why do I keep saying court? I said it last time too. I'm like, and what are we gonna call this? In the room, in the room. I was, for those who don't know, I was federal pretrial for over 17 years, so I lived in the court. So maybe that's just muscle memory. One of the things, if you notice, I put this form, it's called Heat Her. And in your own time, I need you to really peruse that. I don't want to go through it yet because what we're doing is regarding the violence prevention program, it's been recommended that we streamline it and condense it some to make it basically Heat and Her. It still will accomplish everything that we need for it to accomplish. It just makes it a little bit more simplistic, from sides that you will see and you won't see. What you won't see is how it'll make it a little bit more simplistic when it comes to invoicing and basically charges that we have to make sure that are accurate. So when it comes to HEAT, this curriculum, on the back page, the last two paragraphs, community, these include issues related to substance use and involvement in the criminal justice system. Our approach does not assume severe substance use disorder, but focuses on the participants of, what is it? Man, it's some typing, or problematic behavior. And so intensive curriculum focuses in well, you can read it. So, and then go to their website when you get a chance, empowerwithheat.com. It is an awesome, awesome curriculum. And it's long, but it's worth it. I don't think, let me rephrase that. I don't think it's long. Some think it's long, but what a lot of our offenders or clients need, this has been shown to provide great results. So when you get a chance, please look at it a little thoroughly. If you have any questions, we can always come back. Because what we're gonna do now, I'll get back to it, is we're gonna rewrite the contract with Rural Services Solutions, and streamline a little bit, and it'll probably just be called HEAT. But again, it will basically cover everything that we wanted it to cover. And while we're doing that, we're also going to look at all the remaining contracts that we have with our vendors to make sure we're doing effective and efficient work when it comes to making sure they're doing everything in their contracts, as well as streamlining the billing process, invoices, different things like that. So it's this, when we started this procedure of realignment, or whatever you wanted to call it, it's opening up more doors that we have to basically address. But once we get everything addressed, it's gonna flow real well. So I just wanted to keep you abreast on everything that actually is going on. Miss Molly, would you like to add anything, or you good? All right. Okay. Any questions regarding Michigan Department of Corrections contract update of adjusting and going over contracts? Okay, next on the agenda.
Item 4, program statistics update.
Okay, when you get a chance, I need you to pull up just look at the contracts, 25, 26. We're going to have a more thorough at our next meeting. We're still in the process of revamping all the statistics because I believe statistics speak for itself. We're going back. I have some data of from back in, let me make sure I'm going back to 2000. I have from 2016 to 2021 now, grant funding for community corrections, utilization rates versus what they are now. And it shows where we were. And it actually shows 20 and 21 COVID, that's when the drop started. When we were like from 16, 17, 18, you're talking about 88 to 90% utilization rates. 20, we dropped to 60%, 21, 34%. So it's like a climb, but we have to look and find more what happened, If we made mistakes, make sure we don't repeat them again. And not only from 21, I just have the information from 16 to 21. Now I got to get 22 through the current to see exactly what happened. So those are some of the statistics that we're going to be providing to everyone so we can look at it real time, make suggestions, make corrections, uh, remove what's not working, add what's working, so we can make sure that we are maximizing everything that we do. Real quick, if you look at the data on the bottom, these are 4 of our MDOC grant funded programs. I want to show you something just to let you know what the dire situation that we're in. Center for Family Development was it's allotted $125,000 for that program, which is cognitive-based trauma informed program. That's community-based, but we're also allowed to go into jail. That's one of the things we're working at, but it's been strictly community-based for male and females. Originally, it was just for females. They opened it up for males too. From October to February, we've only had 14 new referrals. ETRS, domestic violence jail, from October to February, 10 referrals. ETRS, community-based, from October to February, 48 new referrals. And Laker Village, October to February, also 48 new referrals. And then it tells you exactly how much we've spent so far and how much money we have left over. In other words, we have to start getting people into our programs. That's why I'm excited about neighborhood defense services, as well as everybody we've been at this table, getting information to the judges, making sure MDOC has everything. I've been working as much as I can at the jail, and MDOC has been gracious in helping us along the way. So again, I'm going to send out right now what we have regarding our programs and what we can start doing from actually starting Monday. Once I get the information, if you think somebody's eligible for the program or whatever, and you don't know the process, just reach out to me or my staff, and we'll go from there. Because until we get everything where we want it, we have to do more. So that's one of the things that we'll be able to do. I just said a lot. Any questions or comments?
I do.
Yes.
Just a couple things real quick. So this is the contracts, but it didn't include Real Solutions. I know that they probably haven't received any referrals.
I didn't put any on there because they haven't received any referrals yet, and because we're gonna change their contract.
Okay. So then the next time it'll have Real Solutions listed on here as well. And then you were mentioning the utilization, which I know we get the utilization report quarterly so that we can review it as a board, but this is just to give us a snapshot in advance of that. So will we get this again, or we're going to get the utilization?
You'll get the utilization. It'll be a more complete, a thorough report, 3-month report, quarterly report. It'll be updated, as well as the data from where we were. I wanted us to see what we were. I want us to see also the data of going back to 2016. I really wanted to go back at least 10 years in community correction to get a grasp. You'll see that data, and you'll see the current percentages of what we're using, as well as not only the quarterly report, but one of the things, I'm not sure if it's on the quarterly report. If it's not, we'll also get the percentage of where we're at in money usage and utilization. So for example, in 6 months, it could say we've only used 30% of our budget. That gives us a snapshot of what we aren't doing. And we say, when we come to this table, we have to say, what's not working? What else do we need to do to get this out and get people into our program? Because like neighborhood defense, is it defender or defender? Defender services. They were just like, how much does it cost? And I'm like, none of them, nothing. If they get them in the program, our vendors, we pay the vendors. So I think a lot of stuff that we have to make sure people know there are no assumptions, and it has to be an urgency. It has to be an urgency because um, when I sit in this seat, and what I've done in my career is I always look at it as lives are at stake. And when you talk about PA 511, you're talking about safety to the community. You're talking about improving recidivism and all this stuff. So kind of take it personally when I see that we have these programs, we have these monies, and we're not utilizing them. So that's what I've been just passionate and adamant about trying to um, get us where we need to be. And I know it doesn't happen overnight, but at least start seeing an upward trend in our programming especially when we know the people, we service people, they're coming through CJC that can benefit from our programs. And I'll just leave it at that. Yes.
Just wanted to continue on with the contract document. So thank you for sharing too with us the number of referrals. You went through it. It was 14, 48, and 48. But because that's not on here, but I'm sorry. Take that talk so loud. So, but my question was the rollovers. But so this dollar amount, I just want to make sure that we're clear that this dollar amount also includes the rollovers from the previous fiscal year that's continuing to receive services. And this is not just strictly based off these number of referrals alone.
That's correct. Okay. That's correct. And the next report will also have the rollovers, and and you can understand rollovers will mean that was in the program before the new fiscal budget, which is October 1st.
And with regards to NDF, too, thank you all for being here. We appreciate that insight. I know you're probably still working through what that process looks like. I was just trying to wrap my mind around what those referrals would look like, because we know that in this, we're looking for judges to add it as a condition, or agents are making referrals. What does that look like for you as it relates to our probation population? Because it sounds like they're focusing on that group first, and not the pretrial. So you have an idea of what that would look like as far as the impact on us from the department.
Now the easiest referral process if the judge orders it. That's the easiest process. If the judge orders one of our programs, bam, it's done. But also, just say if an agent gets a person and they review the file and they say, oh, they would benefit from this domestic violence community base. That's where that referral comes into play. They submit the referral. And they meet the criteria they're eligible for, and we'll get them into their program.
Right. We do that part. I'm just asking the correlation with NDS.
Oh, and they'll be doing the same thing. They'll be advocating for, I'm sure I don't want to speak for them.
Okay.
But if it works the way I'm thinking, they will be advocating first to have the judges write the order. And if not, if they come back and they see maybe a social worker or somebody sees that they meet the criteria of our program, they also make the referral. Okay. And if not, if they don't know, they can always reach out to me and we would say, okay, let's make this referral and we'll make it work. We just need 1, 2, and 3 these documents. We're gonna get them in the program and we're gonna start from that day.
Then last question.
Okay.
It's truly the last one. Watch this, Sam. I'm done.
Right.
My parking meter's over.
I got some too. Okay.
You got some, see?
Yeah.
Quick question, last one, seriously. For the Heat Her program, because our staff, the probation agents, received an overview from Mr. Foster, and he went through the 9-month program, and it detailed the Heat, the Her, and it also went into, I think it was the restorative practices, the mentoring component. We're going to have an updated brochure and flyer from them as well that won't include those elements. Okay.
Yes. The pillars that you're talking about be eliminated, and it'll be strictly Heat. Everything will be updated.
Okay. Thank you.
My turn?
Yes.
Okay. it crosses my mind that we've been reaching out to the bench for quite some time to try to get more utilization. But it dawned on me today when I'm listening to all this, such a large number of the cases come through the arraigning judges' courtrooms, Judge Prentice Edwards, Judge Christopher Blount, and now Judge Hathaway. And I don't know if we're going to have any more judges doing that function as well. But those are keys because they move a lot of cases. And docket prosecutors, by and large, dictate the sentences up front because a lot of our deals that we work out are not just a reduction in a charge or a dismissal of various counts, but also involve a sentence agreement that has certain conditions as part of that sentence. And so I think those are the places where you could really focus, get those judges on board, those three judges, and the docket prosecutors on board to utilize these various programs that are available and are being underused. I think those three judges alone could start to really fill up these programs.
Thank you. And just to let you know, that's one of the things that we also are exploring and trying to see if that works, because we actually had one person from community corrections that was working. Currently, we'll have one person that's actually technically the body that's in the jail. Okay, so what we did is I had her last week have another one of our staff. She took them to arraignment court and everything so we can see the process of how it goes and how can we get what you just recommended, how we can put that in effect. So it's in motion. It's just a matter of time of just finding out what can we provide, what do you need so that we can make this happen. So thank you for that, and we'll keep fighting until we get it done. I'm trying to look at my notes to make sure I get everything. Okay, I do. Any more questions regarding the stats? Okay, next on the list.
Item F, such other matters as may be properly submitted before the board.
Nothing.
Item G, public comments. There are no hands on Zoom. And no emails were received. Are there any public comments from anyone in the audience? There are no public comments. Moving to item H, adjournment.
Before we adjourn, I just again want to thank you all for your hard work, everything you're doing. Again, as always, feel free to reach out to me at any time. Questions, comments, suggestions. We're making progress, and that's the key. We're going to keep meeting monthly because of the urgency of what's going on. Again, just thank you so much. My door's always open. Keep my phone with me all the time. It's my lifeline. It has my email on it. I even take my laptop home and everything. I think you all got a email from me at what time was it last night? 9:30 or 10 o'clock, something like that. So we're gonna make it work. And can I have a motion for adjournment?
You don't need a motion.
No motion?
Oh,
Man,
everything.
no quorum, that's right.
It's over.
Well, this meeting is adjourned at 3:54 p.m.
Bill.
Right.
Video only?
And her, I don't know how to do that.
It's everybody. It's just it was creative.
Yeah.
All the writers.
Because I remember cheering.
And Black Sam really got top center. They got to
We are all out of stuff. Every program, only conviction. So now, say, okay, let's shut all this stuff. How do we get there? That's okay. I mean, yeah, that's, you know,
Yes.
Is that just about to be a program that was word that? I don't know.
How are you?